Hello everyone. I know it's been really long that I've come live, but there was this important topic that I wanted to discuss about, and so have finally decided to come and talk about it. So I have been noticing since some time the patients who take treatment post-COVID to improve the immunity, most of them are suffering from hair fall. And it is a known fact, and research also shows that patients suffering post-COVID, from that about 50% of them suffer from severe hair fall. And so I thought of talking about how you can deal with your hair fall, what are the things you can do at home, and when is the right time that you will take an expert advice or opinion to treat your hair fall. So I'm looking forward for people to join me. And if you have any queries, go ahead and ask me, and I will try and answer to all of you all. So just to give you a brief introduction, I'm Dr. Yatri Thakur. I'm a holistic homeopathic physician practicing since 19 years in Mumbai. Presently taking online consultations, and we have come up with our hair serum, which is giving amazing results for hair fall. But I have seen that most of the COVID patients are suffering from hair fall, and let's understand why. So what exactly happens is when you suffer from COVID, most of the vital organs, they go into a repair mode, and your body actually, the whole immune system works towards repairing those vital organs. And unfortunately, hair is the last one which gets its advantage, and therefore hair fall is seen a lot. It is literally like this, that when a person goes through stress or shock, or usually seen post-pregnancy, they are these people who complain of hair fall. And it's not about just one or two strands. They are complaining of hair fall in bulk. Even while brushing their hair, taking head bath, while sleeping, they see their hair all over. Just for your information, shredding hair about 50 to 100 strands a day is normal. But if you have more than that, then it's an alarm stage. And more importantly, when one shreds about 50 to 100 strands per day, shredding is okay, it's normal, but regrowth is where it should happen. If the body cannot produce more hair, or if you see that your hair is becoming thinner, if the margins are becoming thinner and you have bulk of hair fall, think you really need to go for some treatment. Now what happens post-COVID is, apart from our body repairing these vital organs and going into shock, this disorder is called TE. It's called tephroepilepsy. And it is seen usually in patients post-COVID or post-shock. Now TE, actually the hair growth goes through different stages, and when the patient post-COVID cannot go into hair growth phase, that's where the alarm happens and patients feel, okay, my hair has suddenly become thin. This was noticed earlier in patients suffering from typhoid for a longer time, or having post-delivery, even seen during pregnancy. And the thing is, it's seen, this kind of hair fall is seen about 2 to 3 months post-COVID. Now the effect lasts for about 8 to 9 months, and the research is done worldwide, and it is seen that most of the person who suffer COVID, most of them, 50% of them, are suffering from hair fall. Now what exactly we can do about it, and what we can do to deal with it? Now the good news is that this kind of hair fall post-COVID is temporary, so we can treat it and deal with it. And in most of the cases, without doing anything, they become better. Within 6 to 8 months, they see that their hair growth starts coming. But there are still some who need to take treatment because their hair fall just doesn't stop for years together. I'm grateful to all my friends, patients who've joined me. Hi everyone. Thank you for coming and listening to me live. And in case if you have any questions, you can ask me here. Okay, so as I was mentioning, the importance of how to deal with hair fall post-COVID, which is completely neglected, and patients are actually shocked that we have taken good care of ourselves post-COVID and why all this is happening. Now, the best way to find out the how your hair fall or can be reduced or how strong are your hair roots, one needs to do a kind of test. So what you do is take your index finger and your thumb, take few strands in your hand and pull it hard. If your hair doesn't come out, that means your hair root is strong. So, and do this at dozens of places. What I mean is all over your scalp at different places. Try and hold it and pull it. And not too hard, but gently. And see where is the patch on your scalp where the hair fall is happening. It could be possible that this kind of hair fall or is happening only in certain areas or certain patches and it's not happening overall. Though the research is saying that post-COVID the hair fall happens on entire scalp, but in case if you have a specific area where the hair is falling, you can actually concentrate more on that patch. After understanding that what really happens, I would want to give you a few of my tips and tools that you can try at home. As I said, this hair fall is temporary, so which is a good news. But if it lasts for a longer time, you really need to think and do something about it. Okay? Now, let's understand what is the most important thing that we need to do. Firstly, you try and understand where the core issue is. Is it nutritional deficiency? Is it the chlorinated water that you're using? Is it the hair roots which have become very loose? That means the hair circulation is not enough on your scalp. Or is it stress? Or is it that kind of shock that patients go into post-COVID and go into anxiety? Understand where the root cause is and bring your awareness or notice it. Only by noticing it, you have actually crossed 50% of your treatment. Let me give you an example. For example, if a smoker comes to my clinic and says, "Doctor, I want to quit smoking," but till that patient is not aware that smoking is injurious to health, he will not be able to quit it. The same way, once we understand where your core problem is and just bring our notice and awareness towards it and work towards it, 50% of your problem is gone. So find out where the cause is. The next step is change your lifestyle. So sleep for at least 8 to 10 hours. That's where the repairing happens. Listen to your body. When your body says, okay, now I'm ready to work out, work out. But when the body says, today I'm extremely tired, I don't want to pull or strain myself and I want to take rest, just rest. But try and bring a balance. Sleeping 8 hours is enough. Going overboard 2 is not that great. Other thing in lifestyle is change your diet. Now, post-COVID, there is a diet that I usually advise patients, which is called the rainbow diet. Just like different colors of the rainbow, see to it that you have all those different colored fruits and vegetables having high fibers, vitamins in your diet. So have bell peppers, have a papaya which is orange, tomatoes which is red. When you see your platter in front of you, it should actually look like a rainbow with different colors, and choose fruits and vegetables with different colors in a day. Now that itself gives you different kind of nutrients and nutrition balance that your body is looking for, especially post-COVID. Other home remedy that I insist patients on having are nuts, and it's if you can soak about 5 almonds and about 3-4 walnuts at night, soak it overnight. Next morning with the soaked water, have the nuts. As a mid-snacker, you can have mixed seeds. Now this is great in omega-3, so it's great for your hair, also makes your skin much better. So having good fat through nuts is great, which your body needs, especially post-COVID. One more home remedy that I would want to suggest patients is for the hair fall is using aloe vera. But take aloe vera in the natural form, not in any kind of gel which is available in the market. Try getting a leaf of aloe vera, cut it into half, remove the pulp, make it like a pulp, rinse it well, and apply it all over the margins. Leave it for at least 2 hours and then go for a head bath. You will see a nice bounciness in your hair. Also, your hair will become bulkier. To improve your blood circulation, one needs to massage your hair at least twice a day. So the best way to do it, you don't need to oil your hair or anything, only with your fingertips. Just move in circular direction all over your scalp, inside out. Do this literally for 2 minutes and twice a day, and you will see the magic happening. What usually patients do is when they are even massaging, it's usually in the forehead and we forget the hind part. So there is another way you can do is when you comb your hair. See to it, you put all your hair upside down and comb it upside down as well. So the blood circulation in this vertex part is somewhere it's missing out. I see in patients that's where maximum hair fall happens. So do this and see how your hair roots can improve. Also, hair roots are made out of protein. So increasing protein in your diet like dals, pulses, white of an egg does wonders for your hair to make it again more bouncy and more lively and with more volume. Using the right products is as essential. Now again, post-COVID, I have seen that the patients complain of frizziness of the hair. And for that, one more home remedy is you can use curd and apply it all over your margins. Keep it for about 2 hours and then go for a head bath. Also, when you oil your hair, especially the ones who have oily scalp, you start oiling from mid-length till the ends and not all over your scalp. So in that way, your hair roots doesn't become loose. At the same time, you're taking care of your frizziness. A lot of them stop oiling their hair because they say, Doc, when we oil our hair, we see a lot of hair fall in our hands and all over. And I would say don't do that, because if your scalp is oily, it has got the oil production. But what about the hair itself? And that needs to be soft. And if you oil your hair mid-length to the ends, it brings that softness. Let it be there for about 4 hours and then go for a hair bath rather than having head baths so often. For hair fall, there are few things which are recommended through the allopathy side. The treatment goes minoxidil, which is applied all over the scalp. What I've seen in my practice does work, but it works only temporarily. And in fact, after taking for a few months, patients feel good with the minoxidil treatment. But post that, they complain of even more hair fall. So be cautious of what you're using. Whether it suits your hair or not, you need to understand. If you are having any kind of hormonal problems, allopathy side treatment is to use hormone replacement therapy. Again, that could bring a temporary effect and not a permanent one. So be careful of what kind of medicines you're having. Sometimes some medicines cause hair fall too. We have come up with our hair serum. It's absolutely chemical free, safe. We've seen great results in patients within 6 to 8 weeks. Most of them tell us that we find a lot of difference with the hair serum. We are couriering pan-India internationally, so you can get in touch with us. I have a sample bottle here. I can show it to you. All the instructions, how to use it, are written on the bottle. We have different ways of consultations too. Now, when the cause is little deeper of hair fall, like stress, like nutritional deficiency or hormonal issue, it needs to be treated inside out. So we try and help patients externally, of course, with our hair serum, but internally with homeopathy medication, where we understand where the core issue is, explain to the patient the right diet they can have, also the right product and the hair care that they can have. And with this, it works again very well. But even if you try and follow all the tips and tools that I'm giving you right now, it can at least help you with 50% of your problems. And you can reach out to us telling us, how did you feel after watching our video and using all these tips that I've given you? And we'll be more than happy to understand you. Finally, as I said, stress is a major factor to cause hair fall. So when you see hair all over, one tends to become really anxious. When you get anxious, there are certain chemicals that are released in your brains, which in fact causes more of hair fall and loose ends. So you're literally going into a cycle rather than treating your hair fall. So stop thinking negatively, take things in your stride, accept what the problem is, and try and find out what you can do about it. Experts like us are always there to help you, but remember, you're not alone. There are ways and means to deal with things, and there is always a choice that you have to choose the right things for you. So with this, in case if you have any questions right now, go ahead. Yes, okay. Raga is asking how to deal with homeopathy for post-COVID hair loss. Yes, so Raga, with homeopathy, we help patients constitutionally. That means depending on what the problem is, what the personality of the patient is, we give such medicines on homeopathy, which in turn takes care of the vital system, takes care of the immunity, which reduces the hair fall. Of course, as I've been mentioning, we work holistically. So apart from homeopathy, in case if the patient is going through stress, we give them counseling sessions. We have our hair serum, which can be used externally. So it works a great combination with homeopathy. And yeah, so that's the way we help patients with homeopathy. Any other questions? Hi Upma, thanks for watching me. Okay, great. So I don't think there are any other questions, but yes, so I would like to end this session by saying that never give up, never give in, and invest in your hair, because it is the crown of your head and it will give you that glory. And you always have a choice to smile and to spread joy. And with that positive attitude, I would like to end my session. Looking forward to see you all soon. Thanks for watching me.